about collagen. Collagen, we lose 1 to 2% of our collagen function every year from our mid-20s up. So by the time we're in our 40s, our collagen, my analogy is our collagen is on top of the toboggan, going down the toboggan hill. In our 50s, we're perimenopausal, we're postmenopausal. Our collagen is on top of the roller coaster, shooting down the roller coaster and out the door. We've lost 70 to 75% of our collagen function once we've hit our 50s. So that's why we get saggy skin. That's why we get those wrinkles starting. And you can see, for those of you, a lot of you aren't at that age, but in your 40s, you see a change in your skin, right? You start seeing laxness. You start seeing those wrinkles starting. And then when you hit the 50s, that process just kind of accelerates even further. And you get the deeper lines, the deeper wrinkles. You're more hound doggy, you're more jowly. You're starting to get the triple chins. You're starting to get those deeper necklines. You're starting to get crepiness and wrinkles in your décolleté. So what we're doing with microneedling is literally kind of turning back the hands of time, because over time, you're building the collagen, right? You're building the keratinization. You're building as well. The other thing that we're treating is melanogenesis. That's the pigmentation or darkening of our skin. So freckles, any pigmentation, spots on our face. We're going to be reducing those as well. And again, the same thing. Every decade after 30, our melano function just pits. That's why you see all these older people, older than me, I'm not young, but I mean way older than me, you see in their 70s and their 80s, they start to grow those big, huge, dark things that all over their face and all over their body, because their function has just completely gone down. We have the ability now with microneedling to restore these. Now, having said that, we're turning back the hands of time, but guess what? The clock keeps ticking. After every treatment, you still get collagen build, melano build, keratinization for 6 to 12 months post-treatment. So if you start off with a package of 3, you're happy with those results, that's great. But by the next year, you want to do 1 or 2 as maintenance, right? And that will keep your results really good for years, for decades even, right? So we're numbed, we're ready to go. I'm just going to start my treatment.
Now, very quickly, just for the viewers who are just joining us, why would this be advantageous for people in their 30s or just coming into their 30s to kind of get this treatment?
Well, it would be even for younger people. If you're young and you have a lot of acne scars, you could be doing this at 18, 19, and 20 even. And for somebody in their 30s, you're going to start early for prevention, right? It's now the 40s used to be the age when we started to treat. Now everybody in their 30s is starting to treat. So you're trying to do prevention so your skin ages a lot less than somebody else that's not doing any treatments, right?
Sorry, I apologize if we're repetitive. It's for the live viewers.
No worries.
Yeah.
Just keep on asking. And I'm using, to microneedle, hyaluronic acid. Most of you have probably heard about hyaluronic acid. It's in a lot of skincare products. In any skincare product, though, the problem is that it's a humectant and it only sits on top of the dermis. It's a very big molecule. The only way of getting it past the dermis is by microneedling it in. Less? All right. So here we go, and I work in a circular pattern because we can. This is better for resurfacing. And again, because these needles are so fine, it allows us that ability to work like this. And all I'm looking for is pinpoint bleeding. I'm not looking for a pot of blood. You don't see a pot of blood. I'm just looking for these little pinpoints here. And with that pinpointing, I'm happy. I'm happy with my treatment, and I can see the pinpoints here and there. So I'm happy with that depth I've picked. And as you can see from there, you can probably already see that pink, and that's the blood underneath the dermis, right? But very little. This side is drier.
No, it was like a little scratch sensation, like the numbing cream.
Is that okay? And it's a treatment that doesn't take a long time. What's also nice about it is you have to work on the bone. I can't go beyond the orbital bone, but what I can do is I can lift up the brow and I work right in here. Again, for skin tightening and lifting and anti-wrinkling.
And again, for those of you who are interested in booking, we're doing 20% off this treatment, prepay for today, and get your prices locked in.
Oh, she didn't give me any gauze. It's okay, I'll use this one. And I'm treating right under the orbital bone. I'm going right into the tear trough area. Why? Because I want to get all these fine lines and wrinkles that are really close to the eye.
So this is a safe treatment to go near the eyes.
Absolutely. As long as I'm working on the bone, I am good to go.
For those of us who are joining us right now, we're watching the microneedling treatment. Ask your questions, comments, concerns. Now's the time to get them answered.
So you're literally going to be coming out of this treatment a little pink, maybe a couple of those splotchy areas, but I can do a treatment and I can see her face will be similar to mine. You can walk out the door and nobody knows you've just had a microneedling treatment done. That's doing it properly, right? And if you can see, we've got a few, crow's feet around the eye area. So that's what we're targeting with this treatment close to the eye.
And those hard to reach areas, those fine lines and wrinkles around the eyes, this is a great treatment for that.
Absolutely. As well, again, this is a very thin skin here, and there's not a lot that we do for that area. So it just, again, improves that skin, increases the thickness. We get very thin around the eye area, and there's not a lot of treatments that we can do. So this is great for, again, improving the skin tone through keratinization and collagenesis. We're literally plumping up the skin and improving the texture of it and getting collagen build to get that elasticity back that we lose as we get older.
So this is a great preventative treatment for those who are looking for anti-aging results. This would be the treatment for you. For those of you guys who are just joining us, we're watching microneedling.
And again, around the nose and the chin area, you see a reduction in the pore size. You tighten everything up through this treatment. Do lip at the same time. tell you to tighten that up, but not yet. Now I'm going to have her flatten the chin or her upper lip because I want to get right up into the vermilion border. As we get older, we get those little lines in there, and this helps reduce those lines. I've got a nice even pink everywhere. Yeah, I should have done a little more. Do you have any divots under your chin? Or not really? Any little scars or anything under your chin? No. Then we won't do that because you said you're going to have hair removal down there. So we'll do shallow hair again. And flatten your chin for me. Any other questions?
Now, for those of us who are just joining us, we're watching the microneedling. If you have any questions, comments, concerns, now would be a great time to ask your microneedling questions.
Flatten your chin again.
I have a question. I was watching on the TV. You can't have any acne, obviously, for this.
Yes, you can.
You can?
Yes,
Oh, okay.
absolutely. As long as you don't have any pustules.
Okay.
But yeah, absolutely. I've treated big, thick, purple, that
Okay.
really bad acne that's thick, that had whiteheads and blackheads in it, because that's not spreading the bacteria, right? It's only those pustules if you open those up. It's a great treatment for acne, and it's a great treatment for acne scarring as well.
Okay. Because I always get scared because I have some here, so.
Yeah, no, absolutely not. Yours is I would almost consider you clear.
That's because I have makeup on.
Yeah, no, I've treated some really bad acne.
Yours is just those really small ones here.
It's
That's about it.
small.
Yeah.
It's fun.
Okay, we're gonna do
That
cheeks
was
now.
That was a great question.
Yeah. And now we're moving on to the cheeks. And cheeks are thicker, so we tend to do a little bit more invasive treatment on the cheek area. But again, we want everything to kind of look like we've been treating down here. See, we have nice that even pink with just little pinpoints. Nothing too much. And that is, we're going to be treating this now.
You can come and watch inside if you like.
Do you have any questions about microneedling? It's a great anti-aging treatment.
How about, does it hurt?
No, we numb up the skin, so no, it's very tolerable. Model, are we not tolerable?
It's great. I don't feel anything. No.
But it's lip.
No pain. No, not at all.
So with the microneedling treatment, we go in with the numbing cream first, so you don't feel a lot of that. It's a very, I would say Clara's relaxed. Clara's
And-
relaxed, yeah.
Yeah.
And there's always that misnomer because you see people see those crazy videos on YouTube or whatever, and it's not. I mean, we're not
That's
looking
what
for.
I always thought of.
Yeah, no, we don't want a lot of blood. We want
I
pinpoint
thought it
bleeding
was
only.
like a whole bunch of needle going in, coming up, and then
Yeah, no, that's it. And look at her face. Does that look very bad? No.
Now, if you catch the microneedling that we have earlier, so this is a treatment that can work with sensitive skin, reactive skin, acneic skin, all kinds of skin. So you'll kind of get a chance, and we'll be posting it later today.
Okay,
but we
perfect.
had a microneedling that we had done earlier on a client with much sensitive skin, and we'll be posting it before and after of that as well. So we'll kind of get to see the difference between different types of skin.
very cool.
Mm-hmm. So yes, if you are interested in booking a treatment like this, it's 20% off for today only. Prepay, book your spots, buy your products today. It's only today.
Yes.
Yes.
Perfect. Thank you.
And
So and then we do a recovery mask. It's full of matrixyl and hyaluronic acid. Calms the skin down right away. You kind of go ah, and that's what you put on afterwards. I mean, her skin, she hasn't gotten very pink. Some people are more reactive skin and they get pinker. The mask calms them down. She'll walk out of here and nobody will know she's had microneedling done. That's how nice the treatment is. And yet, we've got all those processes: collagen induction, melanin induction, keratin induction, vessel induction. We've got a lot going on there.
So it's good for crow's feet too, then.
Absolutely. Absolutely.
she just went over that earlier a little while. So that tear tuft area, the wrinkles, the crow's feet, all of that. This is a great way.
So you're not just building the skin, you're thickening the dermis, you're working at getting rid of the wrinkles, as well as resurfacing the skin, and you could be working on scarring as well at the same time. It's just many things to be done with this simultaneously. And if you see, I work down into this area here because this is where, as we age, we get baggier there. That's where the surgeons take the skin, cut it, and tuck it behind the ear, right? So I treat that because we want to build collagen there and we want to get it thicker.
And for those of us who are joining us live right now, if you guys have any comments, questions, concerns about microneedling, we have a representative directly from Dermaspark. You can ask your questions now.
And we are done. I'm just going and blending the hyaluron because you can see it gets absorbed into the dermis very quickly, right? Because we're microneedling. Hyaluronic acid is a very big molecule. It doesn't get past the dermis unless we microneedle it in. And it's very good for tying up free radicals. It's really good for the condition of our skin. And it's the ideal tool to use for microneedling. So what we do now is our recovery mask. We open our recovery mask up and put a mask on her face. And we just let them lay here for 20 minutes to half an hour. And again, more hyaluronic is in the mask and matrixyl, and it just soaks right into the skin, calms the skin down. And then you can walk out the door. Some are still more pinky when they leave, and some are literally, I do microneedling, I walk out the door, nobody can even tell I've had it done because my skin is not reactive.
We've got a question here. How long is the downtime for the treatment?
Very little downtime. I would ask everybody not to be going out to like the gym or swimming after the treatment because you don't want any salt, to get into where you've just microneedled. You want to keep that area clean. And other than that, you're pretty well 24 hours. you want to take specific care of your skin for the first week or so. But I mean, there's very little downtime to this
So you
treatment.
shouldn't wear any makeup for 24 hours either? Or
No, absolutely, absolutely. Now you can wear lipstick and you can wear mascara, right? Because we haven't treated that area. But
Now, we also do have a post-procedure special SPF foundation upstairs that you're able to wear post-procedure. But again, for the first yeah.
because your skin, the first 24, 48 hours really is a time when you do not want to have your, you just want to let it go natural and let the skin calm down. You're putting hyaluronic acid on it only for the first 24, 48 hours, and then you can start with some home care product. Now we've got a 2-part mask. What we do with this blue part, if I did the neck or the décolleté, I'd be putting it down there. But because we just did the face, I'm going to tuck this up, fold it back up, stick it in here, and she can put this on before bed for 20 minutes, half an hour. And then
Now, for those of you who are just joining us, that was our microneedling. Originally scheduled for 7 o'clock, but if you're just tuning in, we will be posting all of our microneedling treatments today shortly to our Instagram, so just stay tuned for that. But if you have any questions, comments, concerns, feel free to DM us or ask them right now. Again, this was the microneedling.
Questions, no question is a bad question. And there we go. You can see through her skin. It looks a little pink. But other than that, it looks, tilt your hair, tilt your face. I mean, other than a little pink, her skin looks great.
Yeah, it does.
And her pores are going to be really shrunk. Her skin, the texture of it is going to be improved because we've resurfaced it. And then starts that process, that collagen build, the keratinization build. That takes time. And when you're doing packages of, say, typically 3, you wait 6 weeks before treatments. And then you just start for me, what happened for myself is it was like between treatment 1 and treatment 2, kind of. I saw those great results right away. But all of a sudden, 6 weeks to 2.5 months, I looked in the mirror one day and I thought, gosh, just thinking, oh my God, my skin looks pretty good. And then it dawned on me that it was the collagen build. I'm starting to see the tightening. I'm starting to see the lines dissipate a little bit. And then that just continues to improve. Some people need to do a package of 3. Some people need a package of 6. And then you would do a maintenance. Like if you're going to do a treatment, there are 2 packages this year. Then next year you would do 1 or 2 maintenance treatments. I always like spring and fall kind of. Aging skin tends to get looser in the fall. I don't know why that is. Do you guys find that too? As soon as I get out of the sun, my skin feels droopier.
And we've got another question here as well. Do you typically peel a few days after the treatment?
Absolutely, yes, because we've done a resurfacing. You're going to get some exfoliating, absolutely. You're going to feel a little granular, and that's going to continue to peel off over the next 10 days to 2 weeks. Yeah, your skin looks pretty normal, but it's like asking for nutrients. It's like we've got an ACE cream that's really great, that works well. Your skin is just asking for hydration. So home care, the first part of the home care is whatever is left over in here goes home, and she would use that tonight. When her skin feels tight, an hour and a half, 2 hours later, she's going to be putting this on and tap with clean hands, tapping it in, do the mask before bed, and there is literally, once this is gone, I can tilt this on its side, and there's about 2 full syringes I can pull out of here, sitting on the bottom here. And that's my home care for the next, 48 hours typically. And then that's it.
All right, perfect. Thank you so much.
You're welcome. Any more online questions?
Anybody on our live have any questions about microneedling? Again, it was originally scheduled for 7 o'clock. It was done a little early, but we will be reposting both our microneedling sessions today to our Instagram shortly, so stay tuned for those. Now, if you have any questions about microneedling, we have a representative here directly from DermaSpark. So now would be the time to ask your questions, comments, concerns. We're here to answer all your questions today. No? Okay, so feel free to join us on our Zoom. Link is in our story as well. We are going to be hearing from a representative from Sorella Apothecary, so we're going to head over there now.